In this lesson, we will explore nasal septal perforations, which are holes in the nasal septum causing symptoms like nasal obstruction, crusting, and bleeding. Understanding this condition is vital for future otorhinolaryngologists. In this topic, we will delve into the surgical techniques for repairing large nasal septal perforations. You will learn about the various approaches and techniques used to tackle these complex perforations, including septal flaps, local tissue grafts, and regional tissue flaps. By understanding the intricacies of these surgical approaches, you will be well prepared to provide optimal care to your future patients. In this video, we will explore the importance of nasal endoscopy in assessing nasal septal perforations. We will cover the techniques, equipment, advantages, and limitations of this diagnostic tool, helping you become skilled in accurately diagnosing and characterizing these perforations. Despite advancements in surgical techniques, complications can still arise from nasal septal perforations. In this topic, we will discuss the potential complications associated with nasal septal perforations, such as nasal crusting, persistent bleeding, saddle nose deformity, or nasal valve collapse. Moreover, we will explore the appropriate management strategies for each complication, including conservative measures, medical intervention, or revision surgery. Understanding these complications and their management will ensure the best possible outcomes for your patients. Accurate assessment of nasal septal perforations requires the use of imaging techniques. This topic will examine the role of imaging modalities, especially computed tomography, CT, scans, in evaluating the size, location, and extent of nasal septal perforations. We will discuss the importance of CT scan parameters and imaging findings that aid in proper diagnosis and preoperative planning. By incorporating imaging modalities effectively, you will improve your ability to provide comprehensive care for patients with nasal septal perforations. Advancements in tissue engineering and regenerative medicine are broadening the horizons of nasal septal perforation repair. This topic will explore the current trends in tissue engineering techniques, such as the use of biomaterials, stem cells, growth factors, or tissue scaffolds, for repairing nasal septal perforations. We will discuss their advantages, limitations, and ongoing research in this exciting field. By staying updated on these developments, you will be at the forefront of innovative treatments for nasal septal perforations. Not all patients with nasal septal perforations require surgical intervention. This topic will focus on non-surgical approaches to managing symptoms associated with nasal septal perforation, including nasal obstruction, crusting, bleeding, and odor. We will explore medical interventions such as nasal irrigations, topical treatments, or the use of nasal dilators. By considering these conservative approaches, you will be able to provide tailored care plans for patients with nasal septal perforations. Nasal septal perforation can significantly alter nasal airflow mechanics, leading to changes in airflow patterns. This topic will delve into the intricate relationship between nasal septal perforation and nasal airflow dynamics. We will discuss the impact of perforation size and location on airflow, changes in nasal resistance, and potential implications for patient symptoms and management. By understanding these airflow mechanics, you will be able to better assess and address the functional aspects of nasal septal perforations. Hemorrhage control is a crucial aspect of surgical repair for nasal septal perforations. This topic will discuss various techniques and strategies employed intraoperatively and postoperatively to manage hemorrhage effectively. We will explore the use of local hemostatic agents, electrocautery, or packing materials. Moreover, we will address the challenges that may arise during surgery and the importance of meticulous hemostasis. By mastering these techniques, you will ensure optimal outcomes for your patients. Sometimes, nasal septal perforation repairs may fail or complications may arise, necessitating revision surgery. This topic will examine the challenges and considerations involved in performing revision surgery for cases where previous repairs have been unsuccessful or complications have manifested. We will explore the decision-making process, surgical techniques employed, and potential outcomes of revision procedures. Being knowledgeable in revision surgery approaches will equip you to handle complex cases with confidence. In this topic, we will explore the long-term prognosis and outcomes for patients with nasal septal perforations. We will discuss factors that influence prognosis, such as size, location, underlying etiology, and patient characteristics. Additionally, we will address the potential for recurrence and its management. Understanding the natural course of nasal septal perforations will aid in counseling patients regarding their expectations and long-term follow-up plans. Recurrent or chronic nasal infections, such as chronic sinusitis, can contribute to the development, progression, or exacerbation of nasal septal perforation. This topic investigates the relationship between nasal infections and nasal septal perforation. We will explore the mechanisms by which infections contribute to perforation formation, as well as the impact on management strategies and treatment outcomes. By recognizing these associations, you will be able to provide comprehensive care for patients affected by both infection and septal perforation. Nasal septal perforations can have a significant psychosocial impact on patients. This topic focuses on the psychological and social implications of living with a nasal septal perforation. We will explore the challenges patients may face, including changes in self-esteem, emotional well-being, and quality of life. Understanding these aspects will allow you to provide holistic care and support for patients affected by nasal septal perforations. In conclusion, understanding nasal septal perforations is crucial for future otorhinolaryngologists. By exploring surgery, imaging, and management, you'll gain a comprehensive understanding of this condition and learn the importance of empathy and a patient-centered approach in treatment.